All right, welcome back to the DocBuddy Journal. I'm your host, Eric Sunset. This is episode 47 of the show. And today we're joined by Lisa Blue. Lisa is the Chief of Clinical Innovation with Providertech. She's also a registered nurse with clinical experience ranging from acute care all the way out to FQHCs. And if you're not already familiar with Providertech, I'll give you the 30,000 foot overview. Providertech offers technology solutions to address the complexity of scaling patient engagement while improving operational efficiencies. Lisa, thanks for joining us.
Thanks so much for having me. I'm glad to be here.
It is my pleasure. Obviously, patient engagement, being able to drive efficiency is huge as we're closing out 2023 and starting to look towards 2024. A lot of healthcare organizations having to do a lot more with less than they've ever had in terms of staffing. So, really excited to get your perspective on what value Providertech delivers to its clients. And I think in terms of the best place to start, let's talk about patient engagement. What do you think some of the best strategies are to have effective patient engagement?
Yeah, so patient engagement is really what I would describe as step one, the clinical care process. So, getting communicating to the patient in a way that is valuable to them, that it's time to engage with care. So that doesn't sound like you're past due for this, right? Shame is not a motivator. It doesn't sound like even just a general reminder generally isn't enough. So think maybe what the organization might convey, but what matters to the recipient. And so if I'm a parent, for example, receive a message about the important child's well and how it might affect their school performance. That's a much more engaging type of outreach than or it's time for little Joey's visit. So thinking of the recipient, the intended recipient, and what's going to be most valuable to them is really foundational to that. When we talk about patient engagement, there's a very strategic way that we approach that, and that's really one of the aspects that we incorporate when we're trying to engage a specific population.
Well, that's so important too because you're a nurse, obviously, among many other hats that you wear. So being able to engage patients, get them back to the practice, and do everything that you can to ensure that they have a great clinical outcome is number one. You don't want to view medicine as a production line or as a facility where you're stamping out patient visits and then off they go. But there is a revenue cycle management component to this as well, where highly engaged patients, obviously, they're coming to the facility for care to get that better outcome. But surely that revenue cycle aspect is meaningful to your clients as well.
Yeah, absolutely. Even those that are led to or to care for patients in their own careers, certainly you have to have a successful business to be able to do that. And so patient engagement, while clinical outcomes is really the driving force behind that, the the revenue that it generates is really what keeps the lights on, so to speak, and really allows our clients to not only take care of those people we're outreaching to, but all of the patients in their practice. So certainly that revenue cycle will always be an important element of the self. And so, thinking about the different ways you would engage a population. So, I talked a little bit about the value already. Why does it matter to me as the patient? But the other aspect is really being as specific with the population as possible. So one thing that we've done with our clients is, not just say, these patients that are due for cancer screening, for example, maybe there's a subset of that population that was seen in the past year, but they just didn't get that cancer screening ordered. Perhaps they had other things going on the visit, right? Likely. And so we just need a little nudge. Maybe they need a reminder. We can send them a kit directly to their home, or we can generate a rec to have a mammo completed. Something versus a patient who hasn't been seen at all. they do need to come back in, right? They need to re-engage with care. And so there's really two levers there when you're thinking about the all of those are encompass outcomes, but there's still revenue there when there's a visit associated with as well.
Yeah, and that's easy to lose track of when you're day to day in a practice. You know, you do have to make money to keep the lights on, but patient outcomes primary, of course. I want to go back to one of the things you said to start off our chat, that shame is not a motivator. And I certainly certainly don't think that the bulk of the practices, and even, you know, I'm a healthcare consumer myself, we all are to some extent. You know, you think about an appointment reminder or a proactive appointment reminder to get you back to the practice. It's really easy to say you're overdue, or you have an appointment on such and such day. I would imagine that when you're working with clients, you're looking at large swaths of data out of their EHR, out of their PM. So to be able to move away from the shame motivation, or just the time-based motivation is maybe a gentler way to put it. What are some of the pro tips that you would have to actually do that segmenting out of the software, either that you provide or that a practice would already have? Because that specificity is how you drive action, correct?
That's exactly right. So, what we generally do is we work with our clients to understand what are their clinical quality priorities within relation. Usually, that's driven by things like, you know, their internal quality initiatives. They might have targets for a specific calendar year that are priorities to them. It might be driven by their value-based contracts. It might be delivered by different certification organizations like the Joint Commission or NCQA. So we really work with them to help prioritize what are those targets, and then create an engagement strategy around that. And so you're right; it isn't about waiting for that patient to be past due. It's thinking about how do you proactively look at that segment of the population that, you know, needs that preventative care or that chronic care, and how do you to really to communicate with them in a way that's meaningful to them, but still drives those clinical outcomes at the practice level.
That makes a lot of sense. And when you, I'm going to try to put you on a soapbox here as much as you want to be, but when you look at the overall state of the average American's health, not great. I mean, we've seen the news. There's, like you mentioned, chronic conditions, some self-inflicted, some not, some unfortunately inherited. I would imagine that proactive communication is pulling a lot of weight into helping people manage their health positively versus waiting for a big problem to appear.
Absolutely. So from very basic wellness principles, right? You know, being active and um, being mindful of what someone eats, and medication adherence for those that do already have chronic conditions. Those are really very important things that are to patients in a way, again, that they understand the value to them. But you know, there's also a bigger picture approach to that. So I was just talking to a client that we worked on a lung cancer screening project with, and lung is there's more lung cancer than breast lung cancer, and I think they're combined, I think is what he shared with us, and a lower rate of screening. And so, just like other types of cancer, those cancers earlier are much easier to be treated and managed. And so it really is about helping people understand what part they play in that, but helping them understand if they're feeling okay right now, that doesn't, there's not still risk, right? And so if a patient is someone who's at risk for lung cancer, for example, what we did some outreach to them, and we said, you know, you are, it's recommended you have lung screening, and here's what this is, and here's how you do it, and here's why. Even if you have symptoms today, now is the time to do it. And so, you know, while that seems probably like an oversimplification describing it, that's really one of the core tenets to communicate it effectively, to keep it very simple so people understand that is being delivered to them or being recommended that they engage in this care. So being really simple and consumable with information. Oftentimes in healthcare, we, well-meaning, I'm sure, we provide patients a lot of information. We home with when they're being discharged from the hospital with all these handouts, or, even if we send things electronically, it's in a patient portal. Will they be able to find it? Will they be able to log in? Who knows? And so our approach is really the flip side of that. Instead of overwhelming them with information, think, what is the most succinct way and consumable way I can convey to the recipient, or our team can convey to the recipient, how important it is that they, come back in for that screening, or that they, follow through with, getting their diabetic medication. I think chronic disease is, we often, even in healthcare, I think we make assumptions that people with a chronic condition, they understand that chronic condition. So if they've been, diabetic or had high blood pressure, but the case. And because chronic disease has such far-reaching implications to a person's overall health, right? Diabetes affects every body system. Hypertension affects every body system. And so, helping people understand the just even certain aspects of it. If they're having some of these symptoms related to, sugar, low blood sugar, they could be struggling to manage, their disease process. And so using tools like that to make it more relevant to the recipient. So diabetes, we've done some outreach that says, in the last 7 days, have you experienced any of these symptoms that might be associated with high blood sugar, such as da 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 da, right? And we used that when I was still in my last clinical role. My team and I did outreach. And what was really interesting, so many people responded timely, because they didn't understand that those symptoms they were experiencing had anything to do with their diabetes. And so what really is happening there is very powerful, because one, we're doing really meaningful education, and they're highly engaged because they're understanding, oh, I probably do need to get in. It's not them telling me. Now I understand why I need to have to go in and see my provider.
That's powerful to me too. I tried to get you on your soapbox talking about the state of the average American's health, and so much of it, the spiraling out of control is just a lack of autonomy and a lack of ownership over your own outcomes.
Mhm.
Certainly, go see your provider. Certainly, take what you're prescribed. You need to adhere to your medication, but that's not all there is to it. There's your day to day choices and the things that you choose to do that impact your own health.
Absolutely. The just a little bit, activity, all of those things, while I think they're often underplayed in health and health maintenance, are, really it's the big story. That's where the big story is. And so there's been, I think, some advancements in terms of things like adoptions of Fitbit and things like that. I think it helps people start to pay more attention to that. So certainly that's a step in the right direction, but that's still a small segment, in terms of the entire population, and how to best support them. I think I come from a clinical background that has spent some time in public health. And so we dealt with a patient population that had a number of barriers to even accessing care. And so, really interesting experience in my own clinical career to start to understand what those challenges were, and what our patients were facing. And take a few steps back in terms of what we were asking them to do to engage, how to anticipate those, and make it easier for them to engage with care.
Well, and everything you're saying around being able to engage patients and then for them in turn to engage with their care, I want to zoom way out and go back in time a little bit to the advent of meaningful use, where for those who aren't familiar, you have to either buy or use an EHR and use it how Medicare says, or you get less Medicare reimbursement. That really drove us towards the state of digital health today. I mean, I think it's safe to say providers would still be on pen and paper, and many of them still are, even at the ASC, your surgery centers, but your inpatient care, your your ambulatory practices essentially digitized. I think we can safely
Mhm.
say that.
Mhm.
But the
Yes.
type of segmenting and the type of data mining that you're describing, it's not possible without digital health. I mean, what are you going to go flip through a
Absolutely.
thousand paper charts and figure out who's diabetic and who's not? There's no way. So everything you're describing is not possible without meaningful use kind of kickstarting us down this road,
Mhm.
kicking and screaming, and in some cases, rightfully so. But when we talk about that type of a law, it's sort of that forced adoption where providers still don't like it almost universally. This is
Mhm.
one of the goods that came from meaningful use, though, is being able to look at data at scale, right?
Absolutely. Right. When we like you said, we're going to do audit and charts, even auditing 10 charts, right? I'm from the clinical times where we still audited charts. And so I understand the painful process and the slow process of that. And certainly that isn't something that would us to do any of the things really we're talking about, because, even some of the early days where we put patients into, registries. That was, sort of the early days. There would be a diabetic registry or a cancer registry. It was still something that was manually managed or added to it or removed from it, and so clunky to say the least. So certainly being able to look at big data across a population, and not just say, what percentage of our patients have a chronic condition, but how many have we seen in the last 12 months? How many have we seen in the last six? Three? What percentage are controlled? That's really powerful information, not only from patient engagement, but overall, right? When you're talking about having a practice with 100 providers, and you can look at this practice team's clinical outcomes, perhaps their rates of engagement or control of those populations are a little bit better. Well, good news. What are you doing, right? Like what best practices can we share with the broader group? And I think those are things that help really move healthcare forward. It that degree of transparency that paper charts would not allow us to have, and also to really to to gain, across the industry from some of those best practices.
Yeah, you're so right about all that, and I'm traditionally pretty tough on legacy health IT on this show, and I've been on that side of the fence. I don't know if I shared that with you. I've worked at the traditional health IT vendor in EHR and PM, so I know they're doing everything they can, but the usability just wasn't quite there. So we got to give credit where credit's due. That amount of data being collected, even if the physician and the providers don't necessarily enjoy it, does yield benefits.
Right.
And I think this is an interesting turning point in the conversation too. We talked about meaningful use. It wasn't on our run sheet, but it just can't help but creep into some of these talks. But to turn us a little bit towards value-based care, I know that's near and dear to your heart. How would you assess the current state of play? What are the opportunities for practices? What are you seeing on that front?
So I think value-based care is certainly something that is of utmost importance to our healthcare system. Um, I would like us to move toward it more broadly and more rapidly. So, we're still doing it in a very segmented way. So, I mentioned before, one of our strategies working with clients is to understand what are their priorities based on their value based contracts. And so that that can be difficult to manage in a practice if you have different value-based contracts with different payers and they all have different targets, right? As a provider, how do you know what to focus on? And so I think that tools that are coming out to make that a little for practices, to be able to look across their contracts. So while it's really important, I think it's incumbent upon the people that are designing those programs to make it, just like I'm talking about making it easy to adopt for patients, it has to be easy to adopt for the people that are rendering the care. And so, there can be some ideas on how do you do that. You can look at a practice and say, based on 2024 calendar year and Medicare patients, these are going to be the 6 measures that we're going to target, right? Based on Medicaid, we're going to target these. Have uniformity, I think, would be really helpful to help practices own experience with the managing a care team where we had all of those different value-based contracts in a large practice, or we had over 100,000 patients. And so trying to remember, then this is their focus, and this plan, this is their focus. So I think that uniformity really does matter. Even did it at the like at the governor level, like I'm suggesting. So all of that said, I think the people that went into healthcare, this is the type of care they want to deliver, and so I think that it's really a win across the board. I do think that our EHRs need to be better adapted to again near for our practitioners to if my MA or someone on my team is entering that information, it should be really available when I'm, seeing that patient. Um, the tools can be fine tuned. I mean, I think they have come a long way. Certainly, I do want to give credit where credit's due, but I think we should continue to push them to be better. I also think another area that's going to be really important. You started off this talking about we're all doing the same or more with less resources, and so the to effectively render value-based care or any care that feels meaningful to the patient population that's receiving it, it's going to be really important for practices to adapt to what is available. And so using the team that you have is going to be important. So if you have nurses on your team or health coaches on your team, behavioral health, whatever those resources are, what things can they do as part of that care that don't all fall onto the provider's to-do list? I think that it's not possible for providers to do everything we ask them to do in a short span of time. And I'm sure do they leave feeling frustrated at the end of the day, but it also impacts the patient experience versus if we have that patient in the office and they're seeing their provider, they're able to meet with behavioral health, they're able to, the nurse on the team, and really leverage all of those resources to provide that more robust care. I think that's the only way that value-based care is going to be meaningfully delivered.
Yeah, and to build on that and take us in a slightly different direction, you mentioned you can't pile all of this onto the provider. And I'm paraphrasing, that isn't exactly what you said. But it seems like in this idealized world where value-based care is distributed across the different stakeholders in a given patient's care in a meaningful and equitable way, that at the surface sounds like a way to reduce the feelings of burnout that our providers and our healthcare workers at large are feeling. You think that's the case?
I think that yes, the short answer, but again, I think the tools have to be really tuned in to do that. So, there are, for example, most EHRs have the different notifications that say, this patient is due for XYZ when they're in front of you. There those notifications are not always as accurate as they could be, and then the care team can either have notification fatigue, and maybe they're not even now paying attention to that. And so things like that, when I'm talking about tuning in, are I think going to be really really important, because when we talk about all the technology or all of the information, the big data that exists, the it 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 is a us to be able to connect those systems, whether they're at the enterprise level of a large hospital system that has ambulatory care within it, or to the state health information exchange. We know that those things already exist today, and so it's important to make sure we're maximizing those, right? We're not just like, yes, we have this flow of information, so we've sort of checked that box, but we ensure that if the patient received this care outside of our then, but it's somewhere else that has been reported to the state health information exchange that flows back in. So I think those are the kind of things that EHRs and other technology tools can help really aid in value-based care, as well as reducing the burden of those manual tasks.
That's the final frontier for meaningful use. And obviously, the frontier will continue to evolve, but our high tech act got everybody digital, but the meaningful, actionable interoperability data points just, I know there's a lot of smart people working on it, but
Yes.
that's kind of the next phase where I think the next big step forward will be taken.
Yes. Yes.
And kind of speaking of an innovation like that, I've given myself a really nice segue here for once. Lisa, what are you seeing on the horizon for some of the biggest tech innovations that'll impact patient care in 2024?
So I of course have to speak to AI because it's something that is, always the on every radar to some degree. And I think that I myself am an early adopter when it comes to technology. I think that we need to leverage all the tools that we have available to us. That have to do it in a way that makes sense at each stage of the game. And so when I think about something like AI, there are there are so many things that again are still done manually and cause a burden on the limited resources that we have. And so using AI even internally in a practice to help a provider on their team look at a patient holistically and make recommendations, not just let me refill this medication that prescribed last time, but really across that entire patient profile. Um, Tools like AI could really help look across that large data set and really help the provider in that decision making and recommending the best way to manage those patients. And so I think that AI still some anxiety around it. Understand, not saying that we use AI in all instances, but I think it's about starting to develop a strategic approach and say where are the opportunities, are things that we're still doing manually, that we're expecting our teams to still do manually, that that really certainly has never been efficient, but now we're at a place where it's not even with the shortages that exist today, and that really are going to continue to be exacerbated in our lifetime. And so leverage tools like that to really manage all of this data that we have available to us for improved outcomes.
AI is really interesting to me. There's a number of applications, I guess, that it has slotted itself into. You're seeing some things where rather than having a provider or somebody at a clinic or at the hospital reply to a patient portal message, you could have an AI chatbot, something like ChatGPT. You're seeing NYU has their NYUtron, which is giving structure to scanned charts, like making that a part of the big data silo. That's really cool to me. And you have EHR vendors even implementing ChatGPT into their core EHR to assist with documentation. And we're starting to push up against the provider a little bit in some cases. And this isn't the state of play for AI and large language models like ChatGPT in healthcare today. We're starting to see folks sort of advocate that, you know what, why don't we let the machine treat the patient a little bit more and a little bit more? And there was a tweet thread that caught fire in the last month or so that healthcare is having its top deck of the Titanic moment, which essentially advocated that, there's going to be this whole parallel system of care that's largely ran by GPT like softwares where providers simply signing their name on a diagnosis and a prescription. So you're seeing the whole spectrum unfold from simply communicating with patients for baseline questions documenting in charts, and then the outcome that some are hoping to achieve is to just have a provider be a rubber stamper on treatment plans and prescriptions. Where do you fall on the spectrum? We're talking about two very far extremes. I expect you'll land somewhere in the middle, but some of this seems really feasible and really useful, and some of it just seems crazy.
Yeah, I think that, um, climatic answer here. There is an opportunity to, leverage some of that automation, but I don't think that I don't think that yeah, I'm certainly not advocating that we would move towards, using that in the place of. One thing, we like to talk about is that, when we're doing outreach to patients, for example, an upcoming procedure. So there are, all of us as human beings have different preferences for how we learn, right? So some are going to read, some are going to watch a video, some are going to, have a face-to-face conversation with someone. And so the the efficiency piece really comes in, to one, using tools like that, because there are going to be some people that say, I needed just enough information to understand that I don't take that medication before my procedure and I shouldn't eat or drink after midnight, right? So I'm good. But someone else, maybe they have a more complex history and they have additional questions, or they had somebody had the procedure and now they, afterwards, and like, well, what about this, right? So that first patient, or many of those patients, aren't going to require, that phone call, right? And in a lot of, ASC settings, for example, people are still getting phone calls ahead of their procedure. And so, which is shocking in 2023 that we're still doing that. So, when you think about delivering information like that ahead of a procedure, um, that small segment of patients that require additional support, then instead of having those limited resources, instead of having that nurse call the 20 patients on, the provider schedule they're working with the next day, we can send that message out for them. And if, two two of those patients need additional support, then that can be a phone call. Now that's certainly a lot more efficient, as opposed to them repeating the same conversation and the same instructions over 20 times, right? If they're doing ortho procedures, right, those are going to be very, very, similar instructions. So AI and using tools like that, it's really very similar. I think there's a place for it, but we still need to have the controls when a parachute, to be able to pull the parachute. Like, if I'm a patient and I need to get to a person, that I can easily get to a person to, more information.
Sure. Yeah, nobody likes to be frustrated by autoresponder or one of the phone trees that we bump into so frequently these days.
Exactly.
That makes perfect sense to me. Very well measured there. Well, it'll be interesting to see how the AI space blossoms in 2024, because it will. We're finally moving fast on a technological front in healthcare with something.
Right, right, exactly.
So coming back to our central theme around patient engagement, this is sort of a broader trend type question for you and for what you're doing at Providertech. There's a big gap in generations from our baby boomers down to Gen X, and you got the millennials and Gen Z. What do you see as the key differences in meaningfully engaging each of these groups, or is there one?
Yes, there is one. So it's the same way when I started talking about, looking, the patient population that is due for the cancer screening, and this segment of the population came in this year. Their message is a little bit different. Maybe they just need that requisition generated so they can complete the screening, versus the patient who hasn't even been seen that needs to come back into care. So the the entire communication is different to them. Is a much more, detailed type of engagement. And so the same could be said for any population. If I'm dealing with someone who, has dealt with, more automated communication, or technology tools their whole life, that percentage of that population is going to be much more comfortable with that, and probably maybe only 2% of them will actually escalate to a conversation, versus an older population. We should anticipate that we can still use some tools to communicate to them, but we should anticipate maybe 30% of them are going to require additional conversations from that. There actually is some really interesting data. There's still this assumption that Medicare aged patients don't use technology, and it's still, I don't know. We heard that once upon a time, and sometimes it's hard to change minds. But there's really very interesting data from the Pew Center in terms of the adoption of smartphones, really, even in the 65 plus populations. And so, while they might not be as adept at it, they're using phones. And why are they using smartphones? Because they want to access information easier, like we all do. And so I think that there is a space to use technology across those different generations. I think the way that we anticipate how we're going to manage it does matter. I think the messaging matters based on the age, right? The call to action might be slightly different when we're doing outreach on our clients' behalf for moms. Now, when we're talking about their child's visit, they're much more comfortable doing the entire conversation via text, right? They don't want to pick up a phone, right? And we talk about that, right? Like, consider the population you're communicating with and what are more likely going to be their preferences, and appropriately around that. That doesn't mean there's going to be no one in that population that wants a phone call, but we would anticipate it's going to be a much smaller population segment of the
The,
population.
that's all pretty intuitive, except for that Pew Science research. That's interesting. I'll have to dig that up. And the only reason I bring it up is that when you think about access to care, so step one, I haven't been seen by this clinic, by this provider, by this facility before. It was pointed out recently on the show that if you, as an administrator of this facility, are only taking new patients when they call you on the phone, you are going to be left in the dust because the folks that are entering responsibility for their own care don't want to talk to you. They want it all on the phone, maybe an
Mhm.
app, but it's got to be web forms. Nobody's calling you anymore in the future.
Right, absolutely. And again, going back to the simplicity of the message that I mentioned earlier, the simplicity of the technology needs to be there as well, right? If it's very clunky to log into a portal or something like that, then that also isn't something that most consumers are likely to engage with. So, making it easy to, making the line of communication between the practice and that patient or potential patient as short as possible. That respond to a text message, or they can complete that information ahead of time electronically.
It's amazing what Amazon, click now with one, or buy now with one click, and Uber, click now, you have a car coming in 5 minutes. You'd like to think you're above it and better than it, and you have a little bit of patience. But now with bad technology, why would I have any patience at all? I'll just use the other one if I don't get what I want.
Right, exactly right. Just
So,
recently,
Lisa,
I was going to say, I just went to a doctor myself, and I went to, ahead of time, I went logged into the patient portal. I updated all my patient records because I hadn't been there for over a year, and did everything ahead of time. So I was like, I'm set. And then I get in there and I have to still fill out the same forms that I've done. And I
oh
was
no.
like, what are you actually doing? Then why do you have a patient portal, right? Why are you? And so, that patient experience unfortunately happens more often than not. And so it is a reminder to healthcare organizations. If you're adopting tools, be mindful of what your internal operational workflows are, and that you're not asking people to repeat that, because that is extraordinarily frustrating.
Oh yeah, the patient portal web form is way harder than just scratching it out on a piece of paper. So that's like you're bit twice in that process.
Right.
You didn't take my data, and I did it the hard way.
Right, right, exactly.
Oh, that's so painful. Lisa, want to be sure I hit on your one big thing around patient engagement, doing it the right way, why it matters. What do you got?
I think that being matters. And so that is looking at the population. And by looking at the population, I'm, being very specific. So not just a diabetic population, but, what other demographics do we know about them? Are there social determinants of health that they're facing, right? What's their payer status? All of that information is really important to define the strategy, from the type of message you should use to them, to the frequency of that messaging, right? Some patient populations might just need a gentle reminder. Some might not understand the reason that you're asking them to re-engage in care if they're feeling fine, perhaps. And so being really intentional and understanding the patient population is step one. And then being really targeted in the messaging themselves. So I often, when we're talking to clients, we talk about what message you would want to hear, right? So, often trying to put yourself in their shoes, but that can be more, you know, I may be oversimplifying it by say putting it in their shoes, because we all do differ in terms of what we need, right, and what we want to hear. And so working with understands those different populations and can help make recommendations to you, to that type of messaging. What is the cadence? What is the call to action? Making it very easy for patients to be able to do what you're asking them to do. All of those are. And oftentimes working with a practice, they're like, oh, well, we already do some outreach to patients. And I say, oh, great. What are you doing? And right, it's this very generalized, it's time, it's past due, time to come back in. We'd like to see you. Right. And you sort of deconstruct that and say, like where's the opportunities to make this much more meaningful to the recipient? So understanding the audience really, and being very targeted to that audience is my pro tips for patient engagement.
That is a masterclass to my ears in patient engagement right there. And if I can take a stab at this, it sounds like if you think of it in terms of campaigns or messaging sends or information structures that you want to be sending people, having one of these isn't good enough when you're talking about all of the segmenting you want to be doing. You really probably need a half dozen, 2 dozen, whatever that number is, but one isn't enough anymore.
Right. Exactly right.
Well, Lisa, as we sort of wrap up this episode here, how can our listeners connect with you? Are you big on any of the social medias?
Yes, you can find me on LinkedIn, Lisa Blue. You can also follow our Providertech page on LinkedIn. Our team does a great job of putting out a lot of really great information. So I do urge you to follow us for all the latest and greatest that's happening at Providertech and things in the tech industry.
We're in similar veins there. LinkedIn is kind of it these days. There's
Right?
not a whole lot of reason to keep up on the other ones.
Yes.
Lisa, I want to thank you so much for joining us on behalf of the entire DocBuddy team. Appreciate everybody listening to the show, and be sure you're subscribed on Apple Podcasts, Spotify, and YouTube so you can always get the freshest episodes of the DocBuddy Journal. Until next time, I'm your host, Eric Sunset. We'll talk to you again soon.